Hello, in this video I'm going to be talking about acupuncture, its use, what it might be helpful for, how we think it works, and even how you can get it paid for. Before I go on, I'd love to invite you to subscribe to our channel. We're always putting out new things, in particular when you ask us questions or make comments. And in fact, this video itself was the result of a comment from one of our viewers. I'd also love to encourage you to go to Yerbba.com to get your personalized breast cancer report. All right, so acupuncture, what is it? Acupuncture is an ancient Chinese form of treatment. The thought is that it works through balancing your energy, which the Chinese call your qi. And by balancing your energy and aligning your meridians up in a more healthy and wholesome way, it can alleviate symptoms and get things in the right balance. It's interesting because many physicians who do not have training in Chinese medicine, many Western trained physicians, have actually learned acupuncture for the relief of pain. And the thought is that the needles, which I'll talk about in just a moment, can actually stimulate nerves and lead to the release of endorphins, which are pleasure chemicals. So many anesthesiologists who specialize in pain have learned acupuncture to help people with chronic pain. The way acupuncture works is with very fine needles. In fact, they're so fine that most people don't feel them going into the skin. The needles might be stimulated by being sort of flicked with the tip of the finger to activate the tip of the needle. They might be turned. When they are going in, they're turned to get in, but they might be turned after that to affect the beneficial effects of acupuncture. So the Chinese medicine practitioners will have a diagram of the meridians on your body, and they use normal body landmarks to help them identify them on your body, but you'll see charts and such in their office or in their textbooks, or you can look them up online. And Western medicine physicians will also use the landmarks on your body, like where your hip bone lines up to your belly button, where it lines up to your shoulder, for example. What might acupuncture be used for? Well, acupuncture has been shown to help with pain, and we'll drop a study below that tells you about that particular study. We also have used acupuncture to help with nausea and vomiting from cancer itself or its treatment. It's been used to treat fatigue. It's been used to help people with hot flashes. These sorts of things for which we have very little to offer. So acupuncture might be an option for you if you're having any of these symptoms. You may also have had it for other indications, things like migraines. There are a whole host of things for which acupuncture is used. I do want to make a note about why it's so difficult to say concretely that acupuncture works for a certain symptom. So you're hearing me say it might work, it might help. It is really difficult to do a randomized placebo-controlled trial in acupuncture. And the reason is because the sham acupuncture, where we pretend to do acupuncture, actually has a therapeutic effect. So studies have been done where people receive acupuncture and they also may be randomized, sort of randomly assigned to the not real acupuncture condition and get needles in sort of random parts in their body. The problem with that is that that's actually therapeutic for people, and part of it is the expectancy. Part of it is what people expect to have happen. It can actually be beneficial, like a placebo effect. You know, when we take a sugar pill and we're told it might help with something, we actually release chemicals in the body that do help with that symptom. So 30% of people given a sugar pill to help control their nausea have their nausea controlled. And it's not made up. They're actually chemicals released in the body when we think we're getting an active drug that can help treat pain, that can help treat nausea. So I think that's a really important thing to keep in mind with studies of acupuncture, and why some allopathic doctors, meaning Western doctors, might dismiss it, because we don't have that corpus of research to support it. And we really have small studies where there wasn't a control group, or we have individual stories. And a collection of anecdotes, it's been said, does not make data. This is one reason why many insurance companies won't cover the cost of acupuncture, because we don't have, high-level randomized controlled data from a phase 3 trial. Most insurance won't cover things that aren't supported by that level of rigor of research, but many insurance companies are now including that in their benefits package. So find out if it is included in yours. You may also have acupuncture available to you right in the place where you're getting your treatment, if it's a community cancer center and an academic center. You may also be able to receive acupuncture as part of a clinical trial. So there are lots of ways you might get it covered. And then the other thing is that you might be able to submit a receipt. I'm talking about people in the US, where you can submit things that aren't covered by insurance to a flexible spending or healthcare savings account and get some of that back to you. So these are just some options. It's worthwhile asking the acupuncture provider their experience with getting it reimbursed in people with your insurance type. I find this a fascinating subject. My guess is you might also share your experiences or questions with us in the chat. We look forward to seeing those. We get back to you as soon as we can. And as always, thank you for watching.